Good morning, good afternoon, and good evening, everyone. I'm thrilled to be here with you today talking about the importance of women's leadership in addressing climate and the impact on health. On behalf of Pathfinder and our partner, AMREF Health Africa, we thank you for joining us here today. I want to share three quick stories from Africa to help us ground this work. In the Lake Victoria Basin in Kenya and Uganda, where Pathfinder has been working for most of the last decade through the Health of the People and the Environment Project, we see young girls struggle with many limitations to their options. At 15, a young woman in the region named Fausta gave birth to her first child. By 23, she had 4 children. Like many girls on Uganda's Busi Island, Fausta felt pressure to marry young and grow her family fast. Today, through Pathfinder's support, Fausta helps run the Tree Nursery Cooperative. While the women work, they discuss family planning options and how to utilize the Tree Nursery to increase their savings and build a healthier, more sustainable future for their communities. These women have increased their resiliency to climate change by being able to plan their families, have more economic opportunities, and create a more robust ecosystem through their tree cooperative. Second, with the government of Tanzania, we're working in integrated climate smart landscapes to reduce vulnerability to the negative consequences of climate change on agricultural production, food security, and rural livelihoods. This work furthers women's agency as small farm landholders and simultaneously builds soil carbon, conserves water, and increases crop diversity. Third, we're working in Niger with agricultural experts in the climate vulnerable Sahel region. Here, droughts are intensifying, driving food and nutrition crises. Women and children are among those most impacted. In our programs, men who came to learn about farming stayed on for information on contraceptive methods. Women who were counseled on reproductive health also learned farming techniques. All of this information is central to their health and the community's health. No person lives a single issue life, and our programs must reflect the complexity of the lives they face. We need to do things that are catalytic, that achieve co-benefits. The world is calling for brave new funders, willing to explore co-benefits and set in place the metrics that go beyond the silo of each field. Pathfinder is leading with partners to explore this nexus and who are committed to impact and learning. We're collaborating closely with country leaders who can integrate climate in their existing and future work. Youth leaders are vital to addressing our shared global challenges, such as climate justice and issues surrounding climate change and its impact on the health and well-being of young people in Africa. Today, we're thrilled to have Joshua Amposim, an environmental and climate activist from Ghana, and a youth fellow of the Global Center for Adaptation. Joshua is founder and executive director of Green Africa Youth Organization, GAHO. He focuses on the role of youth in climate change adaptation, disaster risk reduction, and resilience building. And he's the lead author of the first ever background paper on youth and climate change adaptation. This paper provides a pathway for youth engagement in global adaptation efforts. In Ghana, he's leading the Water for Adaptation and Sustainable Communities project, where he builds the capacity of youth to support community resilience through ecosystem-based adaptation measures, sustainable agriculture practices, circular economy, and disaster risk reduction. Joshua, thank you so much for being with us today. The potential of women and girls empowerment and the power of youth voices to drive climate solutions is tremendous. Based on your experiences on engaging youth in the context of climate change, what are the key gender lessons worth sharing?
Thank you very much, Lois, and I'm very happy to be here. And to all our attendees tuning in, stakeholders, very happy to have you here. I would like to start by saying that the humanity's dream for a peaceful world, for a just world, have not been achieved by suppressing or oppression of the feminine archetype and woman. And this is very essential for us to note, most particularly for young people and for young girls. The impact of climate change even affects much bigger from the indirect impact. When a cyclone strikes and when there's a storm happening, there are direct impacts, which typically is what you see on the news, what you see on headlines. This number of deaths, this number of economic destructions. But what we don't factor in is the long-term impacts that gender-based roles put on women following these disasters. So in Northern Ghana, where we run our project, the Water for Adaptation, 66.7% of girls miss school days, and eventually result in them having a lifelong non-professional career or life ahead of them because of lack of sanitation facilities, lack of water availability, which prevents them from accessing school, which prevents them from pursuing their aspirations. Let me move from Ghana. Let's talk about Africa as a collective. Three major events that has happened over the past years. And let's focus on 2019. Ebola. We all know about Ebola, 2,000 plus deaths. Big headline, you know about this. Cyclone Idai, Cyclone Kenneth, 3 million people affected, 1,200 deaths. We know about this. Drought in Eastern Southern Africa, 9 million people affected. Big figures, great. I had the chance to talk to colleagues who are working and who are living within these countries. And what is most essential for you to know that young people are resilient, they are solution driven, but women, and again, the feminine archetype, and because of how society has put gender in boxes, are even much more suppressed, and they have to struggle much more to overcome the challenges that they face as a mother, and particularly as a teenage mother, as a young mother, and all the challenges that come with that. It is essential to realize that within all of this, they are also the ones who take leadership in their communities to build back better, to restore. What is essential for stakeholders present at this summit and at this conference to drive the Africa Health agenda is that the reoccurring of these events is taking away the aspirations of young people. It's taking the aspirations of young women, because Cyclone Idai happened, they had to build back better. In the process of building back better, Cyclone Eloise hit. Same location, bigger impact, you cannot just escape it. So the challenge is up to you. What is your commitment to make sure that the future of young women are going to be better? What is your commitment? Financial commitment, technical capacity, your own institutional setup, your hiring policies, everything that you do. How are you making sure that gender is mainstreamed into your work such that we can elevate the impact that young girls face and young mothers face? Two key things I like to mention: sexual reproductive health and rights. This is something that is a very essential. We know that every country is putting ahead net zero agenda, net zero future. That is important. We need to reduce our carbon emission, but people and communities are facing recurring climate impacts today. And if we don't give them the resources and the infrastructure, capacity, education to be able to secure their future, by the time we get to net zero, they will not even be here. So what is the point in having net zero if there are no humans to live and benefit from a net zero world? Let's adapt for our future. This is very essential, and particularly for young women, we need to strive as institutions, as communities, to get away from gender-based roles and to see climate impact as a collective thing that needs to be fought together. And that's something that we need to give and respect, that historically, women have been oppressed. Historically, women have been put in positions that makes them disproportionately highly affected from the impacts of climate change, and more effort is needed substantially through education and skill development to restore the balance in communities and to make sure that women have their role in leadership in driving the climate agenda. Thank you very much. And I know that Africa Health Agenda can be achieved through women leadership and by men understanding the role that women play and working together hand in hand to restore and have a better future. Thank you very much.
Joshua, thank you so much. Such a pleasure to be with you today, and what a powerful message to get us started. I'm really pleased now to hand it off to my colleague, Riaz Mubarak Ali, our Pathfinder Country Director in Mozambique. Riaz, over to you.
Thank you, Lois. Thank you once again, Joshua, for this amazing keynote at Startup, because this is really a great way for us to get started. Good morning, afternoon, and evening for everyone. This is really a great moment to for all of us to get started and talk a little bit on the climate and health, and the urgency of this multisectoral really approach to strengthen health systems, and also to see how the climate changes and all this brings the burden in the response of the health system. And Joshua, you really brought clearly the key role of young people, of youth, and of women being fully in charge and engaged to drive these solutions. And couldn't be better week to talk about this, and talking about gender empowerment, about women, after the yesterday's 8th March as a Women International Women's Day. So thank you. We will have a great panel today. So I'm really excited to briefly share who will be on this panel. We are going to have 4 stellar panelists, I'm going to say. One of them you have already listened to, Joshua. Joshua, he is the Executive Director of Green Africa Youth Organization, but we are going to have 3 others. We will have Professor Joachim. He is the Technical Director for AMREF, which is Health Africa, who has worked among different areas. He has also worked under HSS and policies. We are going to have Professor Afekena as a special advisor and working closely with Africa Union Commission, and he's been also among the different areas working with policies. So this is going to be an interesting match between different expertises, like the activism, the work, and also how we deal with policies. So this is something that is going to be very exciting. And then we are going to also have Dr. Julita. She is the Regional Director for UNFPA East and Southern Africa. And I think this will be our opportunity to hear from her how she shares the value proposition from the UNFPA, and also perhaps to bring the gender lens from her intro. So with that, I'm not going to talk a lot of the stellar panelists. You will be able to see more details about each of them at the chat box. But what we are going to do is really get started. So I'll pose one quick question for everyone, and this is just to hear from you quickly in a nutshell. Why did this issue of climate is important for your organization? Could we start with that with Professor Joachim?
Yeah, thank you very much. I work for AMREF Health Africa, as you said, and we interact with communities. And over time, through research and the work we do in community, is that when you have droughts and women have to travel long distances to get water, then this is when you also find sexual gender-based violence going up. We have learned that when animals are dying among nomadic tribes and people are losing their wealth in terms of animals, then they tend to marry off their girls early so that they get more wealth through dowry. We have learned that as climate pressures come into communities, you have increased interaction between wildlife and human beings. And I think this is one of the reasons why pandemics and epidemics happen, Ebola, and even now COVID. It is the interactions that happen between animals and human beings. And most of these, many times because of changing climate and each of these humans invading wildlife or wildlife invading humans, and you're having interactions leading to some of these. Now, you might want to find out, why is COVID a female or a gender issue? Some of our studies recently have shown that because of COVID, FGM rates are going up in communities. Women are not delivering in hospitals, so maternal mortality is going up. People are not getting contraceptives because hospitals are busy treating COVID, and people fear going to those hospitals. So whenever a pandemic happens, the gender issues become prominent. And all these many times because of the interactions that are happening between humans and animals because of climate change. If you look at global statistics, climate change causes averagely 150,000 deaths annually. These are direct deaths that come as a result of floods, greenhouse gas emissions, heat waves, and so on. This is direct, but the indirect deaths are even more because of these other things we are talking about. If you look at health expenditure the next few years, it is estimated that by 2030, the world will be spending $2 to $4 billion US managing direct effects of climate change. Because of all these factors, the health sector must never turn a blind eye to climate change. Climate change is a major determinant of health, and we turn our faces out of it to our own detriment. And so as an organization that believes in lasting health change in Africa, we believe that if we can tackle the problem of climate change, then we will improve health in Africa and it will be sustainable. Thank you.
Thank you, Professor Joachim. I think it is really an interesting way that you packed from the challenges and accessibility, wildlife, current pandemic scenario, and even the health expenditure. Could we hear from you then, Dr. Julita, why this is an important issue for UNFPA? Thank you.
Thank you, Riaz, and a very special good afternoon from Johannesburg, South Africa. Can you hear me? I'm assuming you can. So let me first of all say how delighted I am to be part of this distinguished panel, and really to thank CEO Lois and the wonderful colleagues at Pathfinder and AMREF Health Africa for hosting this extremely important session on climate and health. I think already the very substantive and passionate interventions of you, Lois, but also Joshua and Professor Joachim already leave very little more to be said. And I think what is clear is that we are getting that consensus that we need of the understanding of the differentiated and intersecting issues, and really the urgent multisectoral actions that need to be taken for us towards our continent's climate and public health emergencies. So allow me to come to it from the perspective of a multilateral UN agency whose mandate is to call for the realization of reproductive rights for all and support access to a wide range of sexual and reproductive health services, including voluntary family planning, maternal health, and comprehensive sexuality education for young people. And in a way, I feel very much that, you know, you've done my work for me. But really, as part of our commitment to the SDGs and the Decade of Action, UNFPA has put forward what we call our 3 bold transformative results: 0 unmet need for family planning, 0 preventable maternal deaths, and 0 gender-based violence, including harmful practices like child marriage and FGM. And in East and Southern Africa, we've also added a 4th, 0 sexual transmission of HIV. But it is clear to us as UNFPA, and I think to all the SRH partners, that our realization of not only those transformative results as I've put out there, but also the human rights sustainable development, as we outlined in the ICPD Program of Action in 1994, is really under serious threat due to climate change. And maybe what is interesting for us as well, that I do feel that we are getting the sort of political sort of commitment and understanding and recognition of what climate change holds for our African governments and countries. It is just so clear that efforts to mitigate and to adapt simply fall short of the scale, the urgency, and in reality, the design that is needed to prevent and effectively address the impacts on women and girls, as well as vulnerable populations and in marginalized situations. You know, the existing health systems, as you look at them across all our countries, including the work around the UHC and the movement that we so call for in primary health care, you know, are not ready for the array of what will and is we're seeing as the challenges posed by climate change. And so not only is it one of the most disruptive issues of our time, and I think you've all made that quite clearly, but it is also a multiplier issue in existing health vulnerabilities and gender inequalities. And so whether it's in the protection of civilian sites in Bentiu in South Sudan, or in Ambovumbi, the deep south of Madagascar, facing chronic droughts, or in a very hot maternity waiting home of a community in Niger, similar to what Lois was speaking about, or the coastal, you know, lines of Mozambique, which are battered by the cyclical cyclones, as Joshua had spoken about. I think it is our collective duty, and definitely it is UNFPA's, to ensure that no woman dies in childbirth because she cannot reach that service cut off due to floods, that no pregnant woman is malnourished, and that no girl is kept from school because she spends that day fetching water. And so really, Rice, would you like me to go on? I did want to speak to what we then really have taken on board in terms of what we've called our framework agenda. And it's very much based on some of the work that we did in 2019 in the lead up to the 25th anniversary of ICPD. In collaboration with the government of South Africa, we held a landmark international symposium on sexual reproductive health, gender, and climate change resilience. And I must say, on the continent, at least in East and Southern Africa, this was the first time we were bringing that nexus, as Lois, you know, said, together.
That's really very interesting, Dr. Julita, and I think we might come back to that in shortly. I think
please do, because I think that speaks to really what I wanted to really land on, which is really our four areas in which we work in.
And definitely, I think I do definitely see this is a perfect, like how we started, like talking about the community piece from Dr. Joachim, from the activism, the work that Joshua mentioned, but also now bringing in the multisectoral approach, sexual reproductive health, and the emergency on that, tackling the sexual reproductive health in a rights-based perspective, focusing on adolescent and youth, focusing on those unmet needs, and also bringing in the UHC, PHC, education, access to education, retention in school. So all those aspects really makes a whole case, definitely. But we are getting back to that shortly. Before I'd like to hear from you as well, Dr. Afekena, Professor Afekena, if for your organization, why this is so much important, the climate issue.
Thank you, Riaz. First and foremost, the African Union is extremely delighted to be invited to this very important session. I hope it's not too late first, to wish our ladies a happy International Women's Day, which was yesterday, because they are quite important to the development terrain. Briefly, before I answer your question, Let me quickly introduce the African Union. It was formerly known as the Organization of African Unity. That's from 1963 when it was formed to 2002. It is an intergovernmental organization comprising all the 54 independent states in Africa, as well as Western Sahara. I'm not advertising. We are just a one-stop shop to Africa, especially in terms of policy. The AU's headquarters are in Addis Ababa, Ethiopia. And with the recent reorganization taking place, the departments were reduced from 8 to 6. So I'm from one of those departments, the Department of Agriculture, Rural Development, Blue Economy, and Sustainable Environment. So I want you to learn and to know why this is very, very important. We have a Department of Sustainable Environment. The division which handles issues around the climate change, working closely with the Committee of African Heads of States and Government on Climate Change. The current leader is the President of South Africa. We interface and work directly with them, as well as the African Ministerial Conference on Environment, which comprises of all African ministers of environment. Every month, we also meet regularly with the 8 recognized regional economic communities on environment and natural resource management. Now, to come to the specific issue, why this is important to us, first of all, let me thank Pathfinder International for the marvelous work you are doing. The lesson which COVID taught us is how important healthcare is. A few years back, I think there was the Abuja declaration by African heads of states to devote 50% of their revenue, their budget to health. Many of them did not oblige. But after the COVID incidents, I don't think we need to remind any country on why they should allocate enough resources to health. We are very important, happy and glad to be here for at least 3 reasons. The first one is the issues of reproductive health are very, very germane and important in the development terrain, if actually you want to move Africa forward. By my own calculations for 2020, when the latest statistics is available, we find that women now constitute 51% of the African population. So any society that ignores a majority of its population is doomed for failure. So, which is why things like female reproductive health are extremely important for us to take forward. The second important part really linked to that is that healthcare, as we are all aware, does not exist in isolation of social, political, and environmental factors that influence society as a whole. So to have a core understanding, I mean, we need to look at it in totality. The final point is that we do know that Africa is not a significant source of greenhouse gas emissions, as the continent only accounts for only 2 to 3% of world carbon dioxide emissions, mainly from energy and industrial sources. Yet, the continent suffers disproportionately from the impact of climate change, which is set to become the new normal. I mean, we look at cyclones and what have you. So we need to prepare for that. It is in this regard that we want to be able to work and partner with Pathfinder United so that we can bring issues of this nature on board. Thank you, Riaz.
Thank you, Professor Fekena. This is great. While we proceed, I just would like to share that please feel free to all the participants to pose your questions on the chat box or the Q&A section. So those will be captured and everyone will be able to really respond and provide follow-up to those questions. So Joshua, coming back to you, and basically you shared from your initial keynote, a broad scope in all those areas. But I would like to hear from you at this point, what you expect and you see the role of government and other organizations, like governments in Africa and other organizations in the climate issues. So I'll just invite everyone to be. We will be running short in time, so we can get shorter responses. But please feel free to share how do you see it. Thank you, Joshua. Over to you.
Thank you, Riaz, and thanks to African Approach, Joachim and Julita for their interventions as well. I think it's amazing that we have this consensus for the panelists who are here on what needs to be done, the essence of connecting climate, particularly adaptation, not just reducing the emissions, but also adapting communities to reduce the impact that they face and putting a lens on gender. What governments needs to do, I think that the most essential thing now, I think, which should be #1 priority, is making sure that everyone have the understanding of what is ahead of us in terms of the future. And that will start with compulsory education, mandatory education, everywhere in schools, making it part of the curriculum, because all of us on this panel here have been through an education system. And if you're going to look back to the education system we went through, it's not necessarily the future we're living in now or the present we're living in now. Education system is redundant to the future that lies ahead of us. And for young people who still have years ahead of them, who are in universities and in schools now, who are still learning, there is a great opportunity to make sure that they get the understanding, the knowledge of the present we have now with climate change, but also the future. So I find it very disturbing when I hear a rural kid in somewhere in Africa who is advocating for climate change, talking about less flights. A, they do not have the opportunity to fly anyways. Two, that is not what is the most essential thing for them to even advocate for, because reducing emissions will not put them in any situation over the next 50 years. What is essential is for that young advocate to understand that mitigation is important, but they, in their situation in rural Africa, need to adapt to the drought and flood that is happening. And without that education, going through a proper system, young people are then subjected to looking at headlines, frontline, mainstream media. Now, what mainstream media is doing is that it's just communicating what a particular society has agreed on. So we've heard before that we have 10 years to face climate change. We didn't have 10 years. Mozambique didn't have 10 years. The Sahelian Strip didn't have 10 years. They were seeing drought already. So there was no 10 years at that point. So knowledge has to be broken down into very context specific and get young people to see their reality, to know that for the next 20, 30 years ahead of them, there's going to be a extreme weather event. They have to prepare, and that will come along with, on top of the education, skills development. So in the context of women and girls, skills development is very essential, because people need a capital to be able to get and to build themselves as leaders in communities. So we're talking about gender-based roles, we're talking about sexual reproductive health issues. These issues exist, and in every context I've seen in development work, when young women and young girls are given the capacity, the skills, and they're able to start building their capital independently, they are able to get away from these societal or society-defined rules, which sort of put them in a certain disadvantaged position. So one of the essential things that needs to happen is society education, that we need to start getting into a point of delivering the health agenda and the climate agenda, really building the skills of young people, particularly young girls, research skills, technical skills. These are all very essential so that they can play an active role, because it's not, when we say that we need to be on the table and young people need to be on the table, but I've also had instances where young people are on the table, but they are not able to contribute to the conversation on the table because they're not having the understanding and the capacity yet. So as we push for really women leadership, I think it's a shared responsibility, and my organization is doing it, but I think it's a shared responsibility for everyone to make sure that women and girls are getting the understanding, the skills, the capacity, such that when the opportunity comes up, they're able to contribute. So education, skills development, and the last thing I would say is finance. In every context, the finance needed and it's been mentioned across the panelists as well. The finance needed to drive the health agenda is not available. Simultaneously, the finance needed to drive adaptation for countries which are most vulnerable are also not available. So I think it's very essential to then match the health agenda to the climate agenda such that when there is finance available, how does that finance support both the health and climate agenda rather than working in silos where we have adaptation work or climate work happening separately from the health agenda. So we're talking about, say, taxes on elevating taxes on sanitary pads, right? And this is a conversation that is not happening in many countries. How do we make sure finance available for adaptation could also cover such finance conversations that are needed in the health sector? So this will be the three things I will say for now. I know we are short on time.
Thank you.
And I hope we get the chance to deliberate.
Definitely. I think we do have really a very broad topic, and it's challenging to tackle in so short period of time. But thank you, and I think this brings very clearly the education, knowledge, context sensitivity, and how we really pack all these aspects. So, Professor Joachim, at this point, could you share some of your based on your experiences, some of the examples on how health and climate change effects, like how this has been working side by side, hand to hand, like any example from your experience in work? Thank you.
Thank you. Because of time, I'll just talk of three things. One is that it would help a lot if the health sector had a mind shift. If players in health can have a mind shift so that they start seeing climate as part of health, they start seeing forestry as part of health, agriculture as part of health, livestock management as part of health, wildlife as part of health, that will be the starting point into tackling climate change and health. Right now, what we have is the 6 pillars as proposed by WHO. And so most people who do health work are focusing on those 6 pillars and forgetting that the bigger problem out there is the contribution the other sectors are making to determine the health of the people. And in this case, the issue of climate is really cross-cutting and is affecting health in a big way. So the mind shift from the health sector would be really important in starting to manage the way we program around health and how we bring in climate change. The second thing I want to talk about is partnerships. When you look at climate negotiations globally, or even at regional level in Africa, or even at country level, where is the health sector? Who is representing the voice of the health sector? When people either accept to be part of climate negotiations or to pull out, as we've seen in the recent years, is the voice of the health sector being heard? Do they know what this means to the health of the people? And so we need the health sector to be at the table where climate is being negotiated and to put in a voice for the young girl in the nomadic community who is getting raped because they are going for water in far off places. They need to talk about this because of the woman who is missing contraceptives because of floods in some part of Africa. And so the voices of the health sector in climate change negotiations need to be strengthened. And we need to take our space as health workers, as health people who speak for health, to be heard in these places. My final point is the way we program. I think if we can, in our small way, be able to integrate climate change issues into the work we do, we will achieve a lot in our small way put together. AMREF, for example, we have WASH programs that are integrated into maternal health. We manage water sources as part of our programming for maternal health. In South Sudan, we've been able to even support communities to do better agriculture with drought-resistant crops. We've trained communities to be able to, keep fish as part of their nutritional needs because the rivers are drying up. So what do you do to make fish more available? So in our small way as organizations that program around health, if we can integrate bits and pieces of these things, if we can also take the lessons we are getting from communities to the higher level so that people see the relevance of what we are doing in the climate change negotiations, that would be important. Because of time, I'll stop there. Thank you.
Thank you. Thank you. Thank you, Professor Joachim. I think more and more it is really becoming very, very clear the aspect on the multisectorality, how partnerships are important. And this brings that topic on the population health and environment, how we also connect all those aspects. So I'll come back to you, Dr. Julita, and I think it is would like to have you to talk a little bit more on the gender play, on the gender role and this climate change. So I think we can then proceed where you stopped a little bit talking about that integration. Thank you.
Thank you, Riaz. And in a way, I think you know the panelists have really, I think, elaborated not only on the interconnection between climate and the impact on gender. And I think, you know, as the UN system has worked with member states to really move the agenda forward, particularly on climate adaptation, you know, the framing is, and I think what we really need to ensure is really how this then gets, in a way, landed in the context of the work that is being done in countries. And therefore, maybe, you know, just to pick up on where others have, and if there were sort of areas that we need to focus on now. And you know, it is around how countries are able to sort of put that mind shift or that commitment that they've made into tangible policies, programs, and deliver on that for women and girls and for the population. And so I really wanted to go back a little bit to what we have seen as at least 3 areas that we need to be doing much more on. One is really on this, you know, in understanding of those interlinks between population dynamics, global sort of emissions, and really the data set that is able to identify in a very disaggregated way, not only the health impacts and vulnerabilities, but the gender data that looks at climate vulnerabilities and adaptation capacities. And so that's one of the areas that I, you know, as UNFPA, we're really making sure that any form of vulnerability assessment that is needed in the context of climate really disaggregates that data properly, understands to which parts are people being left behind, and then uses that to program and to develop effective policies. The second is really around this building of resilience, and I think Joshua said it extremely well, that how do we really build resilience of people and communities, not only to just think of mitigation, but to particularly look at adaptation, because indeed it is there for us. I do want to sort of end, because I'm not sure Riaz will come back to me, but to really actually say that the opportunities, particularly as we lead up to COP26 in Glasgow in November, are key. And in fact, all of us need to be mobilizing in a really particular way towards that. And there are a number of advocacy areas that I think are really key, especially, and I'm glad the Africa Union is engaging with all its platforms, but also the regional economic communities. But one of the areas we've really looked at is the process that's ongoing to revise national determined contributions. And to particularly look within that and national adaptation plans and gender action plans in countries to see how they've reflected issues of health, issues of gender, issues of resilience in those plans. And in fact, some work that we did recently with Queen Mary University in the UK had showed that for for 50 of the national determined contribution plans that we looked at, only 9 mentioned in any way issues of health. So we really are quite far behind on those. And this year we have the 65th Commission of the Status of Women coming. We have the Commission on Population and Development looking at population, food security, nutrition. This year is the Gender Equality Forums in Mexico and Paris around Beijing. And we have a coalition on feminist action and climate justice. We have the High-Level Political Forum on the SDGs looking at SDG 13 and others. And of course, we have on the sidelines of the COP26, a global conference on health and climate change being hosted by WHO and Global Climate Health Alliance. And so we feel that all these opportunities are important, particularly for African member states, to really raise their bar and you know, put really the language that's needed to actually get the sort of resources and the action that's needed to move forward on these things. Indeed, the moment is right. We are all talking about building forward greener, better, smarter, more inclusive and just post-COVID. And I do think we are seeing, at least the Secretary General for the UN has called for 50-50 climate financing to include adaptation. And so this is our opportunity. The Africa Development Bank is looking at an Africa Climate Change Fund. And so there are many opportunities, I think, that we can really leverage at this point in time to make the difference. And I really call on us partners to come together. And this is maybe the final issue around the coalition and collaboration that we need to really ensure that this is the moment that we really position health, climate adaptation, and gender work. I'll stop there. And if you give me one more chance later on, I just really want to say something about our work with youth, because I think, you know, Joshua, you know, what he said inspires. And indeed, we are trying to look at ways in which we can create that platform for youth to work on population, SRHR, and climate change. And really to raise that to a higher level. Yes,
thank you.
Thank you.
And this is really great. And I think this again reinforces the whole messages that we keep talking about. And I think this brings again what Professor Joshua, they were talking about the demographic characteristics of Africa in particular, where we definitely see that there is more than 50% of women, but also our age pyramid overall in Africa is very, very broad at the lower end. So like the basis is very large and there is a lot of unmet needs in different areas. So I think, yes. Professor Afekena, what do you think that we need from Africa Union and other global organizations to push to advance with this climate policy initiatives, to put this forward, to really make changes and advance on that? We have been talking a lot on integration, the resource allocation and mobilization, advocacy work, but what really can be done and from the perspective of Africa Union as well?
Thank you, Riaz. I will try as much as possible to speak for the Africa Union, not other organizations. And mine logically will be a continuation of where Joaquin and Madame stopped. Invariably, to a few years back, I mean about 3 or 2 years now, I'm not too sure, but shortly before COVID, I represented the Africa Union at a conference in Gabon, where African health ministers were meeting with their environmental colleague. I was very excited. But after that conference, I don't think much has happened, especially at the national levels. So you see how this dichotomy, those people in the environment are doing their own thing, while health are on their own part, this silo mentality that will not lead us anywhere. So I think the Africa Union has a lot of convening power, which we can leverage on. I'm bringing these two areas together. As part of advocacy on awareness creation on the interface between climate change and health. And we can take your declaration forward, beginning with this meeting, through the following channels. We can table it to the African Ministerial Conference on Environment. For them to rethink this interface again. The second one, if they think it's important enough, they can then elevate it to the Committee of African Heads of State and Government on Climate Change. Finally, like Madam said, the Conference of Party is the decision, the highest decision-making body of the United Nations Framework Convention on Climate Change, UNFCCC. In November 2021, the UK will be hosting the 26th annual session of the Conference of Parties to the convention, what is referred to as COP26. It was supposed to have been held last year, but because of Corona, it was moved forward. At the TOMIC summit, which will take place in Glasgow, delegates, including heads of states, climate experts, and negotiations, we come together to agree on coordinated action to tackle climate change. As well as the negotiations, there will also be scope for countries, international organizations, and other delegates to showcase climate action, highlighting diverse climate change issues, and share knowledge. So my recommendation is that we should take advantage of this meeting, because Africa goes to such meetings with well-prepared and a common African position. We can exploit these channels because very soon, like Madam informed us, countries will be revising their NDCs so that we can capture a lot of this interface between climate change and health. Thank you, Riaz.
Thank you. Thank you very much. And I think this is actually, from all the comments that we are having, it is bringing us to one of the earliest definition on health from WHO, when it was always stating that it's a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. Because I think this is how we start to bring in all the aspects on how the environment where we are is influencing our way of living and is influencing our well-being as such. And sometimes this is something that it's so much integrated with the access to health. It is related with our response ability to health matters, that we start to forget that health is not just the absence of disease. So I'll give like 30 seconds as a key message, that 30 seconds sharp for everyone, if you want to really give a take-home message. And I'll start with you, Joshua. What do you want that everyone at least could pick from what you have said to start really packing their brains and a daily work on the climate and health?
Thank you. 30 seconds, clock is ticking. One, finance young people. Trust young people that they know the solutions. They are young professionals. If you give them the resource, they will deliver impact. That is very essential. And that is for the youth community as a collective group. Two, I want to see how institutions like the UNFPA and the Joint Youth Working Group, which is coming up from the UNFPA, together with other youth organizations, can really deliver a huge statement on this at COP26 and at a pre-COP event in Italy. So that is the next thing. Third thing, as individuals, we need to check ourselves and see how are our institutions and organizations are integrating gender in our everyday activity. Because we can challenge governments and private sector, whatever, it comes down to us. We as individuals need to start practicing, we need to start preaching. How many of our internship programs goes to young women? How many of these internship programs have been paid? How many of them are resourcing young people? So this will be my three key sort of living message. And thank you very much for the opportunity.
Thank you, Joshua. Professor Joachim?
Yeah, thank you. I think for me, one is if you are programming around health, think beyond the 6 pillars. and include climate change in that broad spectrum of thinking. That is where health begins. Secondly, integrate climate change, and in whatever we do in our small way will add up to a very big outcome. And finally, partnerships. If you can't do it, your partner can do it. It will fill your deficit as an organization. And so we need to partner. That includes partnerships with private sector, not just the public sector. Thank you.
Thank you. Dr. Julita?
Yes, all my messages have gone with my colleagues ahead of me. So just to say encore, but really, I think the opportunity is now. We can't afford to waste time. I think Africa has a huge, not only responsibility to its people and particularly its women and young people to ensure that not only their health is realized, but that climate change doesn't hold us back. And so for me, again, you know, how we can bring together sexual and reproductive health, gender, the leadership that women and young people have, and the climate adaptation agenda is going to be key for moving the continent forward in a prosperous and fair manner.
Thank you. Thank you very much. Professor Fekena?
Yes, thank you. I think I have just one key message. The interface between climate change and health is extremely important. A lot of opportunities are opening up this year, and we need to seize the moment. Thank you.
Thank you very much. Let me just, thank you. Thank you very much, everyone. And I think just before we close, from everyone's contribution, I think it has been really very, very clear that climate and health should go hand by hand. It is not isolated as an issue. We have definitely to see it more broadly as a cross-cutting, multisectoral. We have to integrate more. We have to broaden our scope. Partnerships, coalitions is key. Education is instrumental to really be able to advance this agenda and education at all levels. And that's an empowerment approach to educate. And I think that's where we have to really also invest. And talking in investment, I think it has become very clearly the resource allocation, because this is something that we do not prioritize. We try to see all the interventions still in silos, but less integrated. And I think this is our opportunity to really engage more on the multisectoral approach and definitely reinforce the decision makers. Definitely, this is not a closed conversation. It is really a broad topic. So I would like first to thank you all, Dr. Julita, Professor Joachim, Africana, Joshua, for being here today, joining all of us and sharing your thoughts and your passion on this matter. Thank you very much. Bye.
Thank you, Riaz and the colleagues. Bye.